Good evening, everybody. Welcome to this evening's session, and we are going to look at contemporary midwifery care. Contemporary midwifery care refers to the current practices and approaches in midwifery that address the evolving needs and preferences of women and their families. Let's look at holistic approach. Contemporary midwifery care embraces a holistic approach whereby we have to consider the women's health, physical, emotional, social, and cultural aspects. So midwives provide comprehensive care that extends beyond the clinical aspects and also focuses on promoting their overall well-being. Let's look at women-centered care. Women-centered care is a central principle of contemporary midwifery care. In women-centered care, midwives prioritize the individual needs of the women, their values, and the preferences of women, ensuring their active participation in decision-making and also planning. When we talk of participating in decision-making and care planning, what we mean here is that the woman should make a decision with regard to which midwife will conduct her delivery, which doctor should be there, who should be there when she is delivering. Continuity of care. Contemporary midwifery emphasizes the importance of continuity of care, where women receive care from the same midwife or a small team throughout their pregnancy, childbirth, and postnatal period. So, the continuity of care promotes a trusting relationship, personalized care, and also improved outcomes for the mother. Let's look at shared decision making. Contemporary midwifery promotes shared decision making between the midwives and the women. Midwives also provide evidence-based information, support women in making informed choices, and involve them in making decisions. For example, if a woman decided that maybe she wants to deliver at home, but as a midwife, you may realize that this woman maybe was having a previous scar, or this woman had a scar due to a cesarean section, and she's going ahead to tell the midwife that she will deliver at home. So the midwife has to step in and inform the lady of the disadvantages of delivering at home. So when the woman is satisfied with the disadvantages, so you find that with the support which the midwife has given, that no, it's not good to deliver at home because of the risk of rupture of the uterus, then the mother will be able to make a decision and opt to deliver now in the hospital. And this decision the mother is making it because of the support which the midwife has given to the mother. Cultural competence. Let's look at cultural competence and the diversity. Contemporary midwifery recognizes and respects the diverse cultural backgrounds of women and their families. Midwives undergo cultural competence training to provide culturally sensitive care that respects cultural beliefs, practices, and also traditions. So usually, at most, midwives learn about the different cultures of the different women, let's say of most of the women in the world. At least the midwives are aware of those cultures, such that when the midwife is providing care for these ladies, the pregnant women, the midwives are supposed to respect these cultural beliefs, practices, and their traditions. But if a cultural belief is not good and it is not favoring midwifery practice, then the midwife is going to advise the mother on that particular practice. For example, there are some cultures that believe that when a woman delivers a baby, the first milk, that is colostrum, that it should be expressed and not be given, and it should be expressed out. The baby should not be breastfed on it. So, with such ladies who could be having such kind of belief, here it is important for the midwife to chip in and inform the lady that it is important that the baby is breastfed on the first breast milk, that is the colostrum. Why? Because the colostrum has antibodies that are helpful for the baby. The colostrum also quenches the thirst of the baby. Remember, within the first hour when the baby is born. So if the mother understands now the importance of breastfeeding the baby on the colostrum, then she will eventually refrain from that culture of expressing the colostrum away. So it means that some of the cultures, some of the practices are good, then some of the practices are not good. So what does it mean? It means that the midwife is going to encourage those practices that are good. But those practices that are harmful to health, the midwife is going to the midwife should discourage them. Let's look at collaboration and multidisciplinary care. Contemporary midwifery involves collaboration and teamwork with the other healthcare professionals such as the obstetricians, the nurses, the neonatologists. Those are individuals who take care of the neonate, and the other specialists. Midwives primarily provide low-risk care, while obstetricians handle high-risk cases and provide medical interventions when necessary. What we mean by low-risk care, it means that midwives are going to take care of mothers during the time of pregnancy, labor, and delivery, that is, if this mother has no complications. While the obstetricians will take care of high-risk cases, for example, if a mother is having diabetes at the same time she is pregnant, or if a mother is having high blood pressure, or if a mother is having other medical conditions like asthma, whereby intervention is needed, then it means that the obstetricians are going to take care of these mothers. So, this multidisciplinary approach ensures comprehensive and coordinated care, particularly for women with complex needs. Let's look at integration of technology. Contemporary midwifery embraces the appropriate use of technology to enhance care. For example, the use of electronic health records, telehealth, whereby the client can be able to chat with his doctor or the obstetrician via a video or via an application that could be on their phone. And also, remote monitoring can improve communication, access to information, and also continuity of care. Let's look at advocacy and health promotion. Contemporary midwifery introduces a focus on advocacy and health promotion. Midwives empower women to make informed choices concerning their place of delivery, who should be there present during the time of delivery. Midwives also help to promote health education, that is, educating the women about danger signs during pregnancy, diet during pregnancy, and how they should take care of themselves. Midwives also advocate for women's rights and also improve maternity care services. Let's look at challenges and considerations. Adequate resources and support for implementing contemporary midwifery care may vary across healthcare systems and settings. Overcoming barriers to collaborative practice and interprofessional communication can really be a challenge. Let's look at traditional or independent midwifery model. The traditional or independent midwifery care model is based on principles of continuity of care, and the midwife is the sole primary care provider. So independent midwives typically care for in-out of hospital settings. For example, these midwives can take care of the mothers in their homes, such as home birth or birth centers. So, the traditional model of care emphasizes on personalized women-centered care and also promotion of natural childbirth. Let's look at team-based midwifery model. In the team-based midwifery model, midwives work collaboratively with other health professionals, such as the obstetricians, the nurses, and also the donors, Donor means a person or a person who donor comes from a Greek word, and it means a woman who serves. So donor could mean the person who is continuously supporting the woman physically, emotionally during the time of childbirth, miscarriage, or uninduced abortion. So, the team-based approach ensures a multidisciplinary approach to care, combining the expertise of different professionals. Midwives often lead the care, but there is a shared decision-making process and coordination among the team members. For example, you find that the woman is in labor. She was okay, the labor was progressing very well. Then later, all of a sudden, the situation changes whereby maybe the contractions become very weak, and when time comes to push the baby out, the woman cannot be able to push the baby out. Then here it means that the obstetrician needs to be involved, and also other members of the team. Maybe the mother may necessitate an emergency cesarean section in case the fetus was having fetal distress. So you find that other team members are going to come in. For example, here we will need the obstetrician, we shall need the anesthetist. We will also need the theatre nurses who will be able to help when they are carrying out the cesarean section. Let's look at midwifery-led continuity modules. These modules focus on providing continuity of care by the same midwife or a small team of midwives throughout pregnancy, childbirth, and also postpartum. So the midwife follows the woman from the prenatal period through birth and into the postnatal period, providing comprehensive and personalized care. This module has been associated with the improved outcomes, higher satisfaction rates, and also reduced interventions. Why? Because most of the times the woman is already used to the midwife, so she will not fear her. She will not become anxious during the time of labor because she's already used to her, other than a woman who is coming into labor and is meeting a midwife for the first time because she does not know the midwife and she's also worried. She doesn't know how the midwife may treat her. So this module is good because it improves the care of outcome and has a higher satisfaction rates, and they reduce the interventions. Interventions, like when we talk of intervention, we mean interventions like vacuum extraction or a cesarean section. Let's look at the integrative modules. Integrative modules combine midwifery care with the other health care services such as maternity clinics or hospitals. These modules aim to create a seamless care experience by integrating midwifery care with the access to medical interventions when needed. So the goal here is to provide women with various options and ensure that care is tailored to individual needs. Let's look at respectful maternal care. Respectful maternal care refers to providing healthcare services that uphold women's dignity, autonomy, and rights throughout their maternal journey. It involves treating women with respect, kindness, and cultural sensitivity while ensuring active participation in decision making. What does it mean? Here it means that the woman must be involved in making the decisions. It does not mean that most of the time the midwife or the health team are the ones to be making decisions for the woman. Let's look at the components of respectful maternal care. The first component is dignity and privacy. The midwives should respect the women's privacy, modesty, and confidentiality during all interactions. When the midwives are communicating with the woman, they should ensure confidentiality. Maintaining a supportive and non-judgmental environment that preserves the woman's dignity. The second component is autonomy and informed consent. Respecting women's rights to make informed decisions about their bodies and also health care, and ensuring women have access to accurate and comprehensive information about their care. For example, if a mother needs to be taken in for a cesarean section, there should be a consent from the woman, or if the midwife needs to carry out a procedure on the mother, for example, if she wants to empty the bladder of the mother, which means she's going to pass a urinary catheter, it means that the midwife has to seek consent from the mother first before passing the catheter to the mother. Let's continue with the components of respective maternal care. Communication and shared decision making, that is prompt, opening, effective and respective communication. This should be between the healthcare providers and women. Engaging women in shared decision making process and also considering their preferences and values. What does it mean? Here it means that most of the times the midwives should not take decisions by their own, or they should not instruct the women what they should not impose instructions on the woman without seeking the view of the women. Number 4, emotional support and empathy. Providing emotional support and empathy to women throughout their journey. When we talk of journey, which journey is that? It means the journey from the time of pregnancy, labor, and postpartum. So, emotional support and empathy. Midwives should provide emotional support and empathy to the woman throughout their journey, throughout their maternal journey, acknowledging and compassionately addressing women's fears and anxieties and also concerns. Let's look at components of respective maternal care. Cultural sensitivity, recognizing and respecting the woman's cultural beliefs, practices and traditions, and also adapting care to meet individual cultural needs and also preferences. In the world, people have different cultures and beliefs, so the midwives should be well versed with the different cultures of people such that they are able to respect the cultures of the women and also their preferences. Let's look at the benefits of respectful maternal care. The first benefit is improved maternal satisfaction and well-being. When the mother is satisfied with the care, for example, during the time of labor, it means that this mother is not going to feel very anxious and the labor will go smoothly without any problems. Number 2, there is increased likelihood of positive birth experiences, what I've just explained. Number 3, there will be enhanced trust and cooperation between women and healthcare providers. Number 4, there will be a reduction in maternal morbidity and also mortality rates. Let's look at the barriers and challenges. Lack of awareness and training on respectful care practices among healthcare providers. As you know, some of the health providers may not have undergone the training of respectful maternity care. So it is important that as midwives should be trained on the aspects of respective maternity care. Second barrier is systemic factors such as limited resources, time constraints, and also understaffing. When a midwife is working in the labor ward and she is alone, it's really very taxing. It means that she may not be able to, at times, provide the respectful maternity care because she's alone. She has to carry out a lot of procedures. So that's why it is important that at most, if it is in the labor ward, at least there should be 3 midwives who are there on duty for the midwives to carry out respectful care for these women, because if time is not enough, time constraint is also another factor, whereby you are attending to so many women and you are alone and the midwife is alone. The third barrier is social cultural norms and biases that may impede the provision of respectful care. Let's look at the definition of evidence-based midwifery care. Evidence-based midwifery care involves conscientious and judicious use of current-based evidence in making decisions about caring for women and their babies. The evidence-based midwifery care combines the best available research evidence, clinical expertise, and women's values and preferences to guide care practice. Where do the midwives get these evidences? It means that the midwives should read research evidences. So many researches have been done out there. So the midwives should read these research evidences such that these evidences will be able to guide them when they are caring for the women and their babies. Let's look at the benefits of evidence-based midwifery care. Number 1 is improved outcome. Evidence-based practices have been shown to improve maternal and newborn health outcomes. So by utilizing the interventions and approaches supported by solid evidence, midwives can enhance safety and optimize outcomes for women and their babies. Evidence-based care promotes using interventions only when necessary, so this reduces unnecessary medical interventions also. When we talk of interventions, these interventions could be in terms of vacuum extraction, cesarean section, okay? So this reduces, using evidence-based care promotes the reduction of those evidences and also unnecessary medical interventions. The evidence-based care approach helps to minimize risks, it avoids potential harm, and also supports the physiological birth when appropriate. Let's look at the critical components of evidence-based midwifery care. One of it is systemic review of research evidence. Midwives should regularly review and critically appraise the latest research evidence relevant to their practice. So, if the midwife reviews the latest research evidences, this will ensure that they are current with current knowledge, and also they can incorporate new findings into their care practices. Midwife's clinical expertise is gained through education, experience, and continuous professional development. Is essential in applying research evidence to individualized care. What does it mean? It means that now and then the midwife has to read the recent research articles such that she is able to find the best evidence practice such that she is able to utilize it on patient care and also care of the babies. If the midwife does not read the recent research articles, then it means that she is going to stick to the old knowledge and she will not change the practice. Therefore, it is important that midwives should continue reading and not sticking on the old knowledge. So clinical expertise allows midwives to assess and interpret evidence in the context of each woman's unique needs and preferences. Let's look at women's preferences and values. Evidence-based care recognizes the importance of women's practices and values in decision making. Midwives should engage in shared decision making with women, considering their individual needs, cultural needs, and also personal values. Let's look at continuous professional development. Midwives should engage in ongoing education and professional development to stay informed about the latest research and evidence. Regular training updates the knowledge of midwives' skills. This enables them to provide evidence-based care. Let's look at challenges and considerations. Access to up-to-date research evidence may be limited in some settings. For example, if a midwife is working very deep in the local areas whereby she cannot be able to, whereby the internet or the network is poor, at times it is difficult for the midwife to get access to the recent research updates. Second challenge is overcoming resistance to change and ensuring a culture that values evidence-based practice can be challenging. Why? This is because some of the midwives, once they have qualified, they sit back and they say now it is done. They don't want to read articles again because they are tired of what? Of reading. But this is not good. As midwives, you are encouraged to continue reading recent articles. This will help to update the evidence-based practices. Challenge number 3, balancing evidence-based care with individualized women-centered care can require careful navigation. It is not easy because every woman should be treated as what? As an individual. That's why we are saying that balancing evidence-based care with individualized woman-centered care can require careful navigation. In summary, we defined contemporary midwifery care. We also looked at cultural competence and diversity. We also looked at collaboration and multidisciplinary care. We looked at integration technology, advocacy and promotion, challenges and considerations. Then we looked at the different modules, we looked at the different midwifery care modules. We also looked at its benefits and the challenges. Then we also looked at evidence-based midwifery care and its benefits and challenges. Thank you for listening. Have a blessed evening.